Yeah. Hey friends, this is Fabians, and today I come with interpreting X-ray made easier for medics. This is what all of you medics need in your career to enjoy the field. Interpreting X-ray. This is a video that will give you all the basics required for you to master and understand X-ray interpretation. So thanks for watching. Yeah, so there are five areas of density that we consider when interpreting X-ray, going from black to white. So first and foremost, we have a black, which represents basically air. Things that are air density on X-ray will appear black. Then we have dark gray. This represents the fat tissues. Of course, you know fat tissues. Then we have light gray that represents soft tissues like the heart and blood vessels, etc. Then we have off-white. This represents bone. So everything that is white, obviously you know that it is bone. Then we have bright white, which represents metal. Yeah, it will appear as sharp, very white, very bright white, sharp. On X-ray, you will know that there is a metal in some certain tissues. So these are the air densities that we consider much when interpreting X-ray. Then we have the shooting of X-ray film. We can shoot X-ray film depending on where you put the board or correcting X-ray. So when we have AP, which is anterior posterior, then we have the PA. So when the body correcting X-ray, the X-rays is put behind the patient, that is AP. And when the body correcting the X-rays is put in front of a patient, then that is PA, posterior anterior. So this is what, of course, these are positions when shooting X-ray film, where the patient stands, how he stands, and then how. Then again, there's something small mark on top. For instance, now it is marked with letter L, and it shows the side of a patient. Now let's go. The first thing I want us to talk about is, let's begin with the letter A, which represents trachea. As I'm shading the trachea, of course, which comes down, as you can see, then makes branches through the way, and then to the other side makes two branches. That is the trachea. Looking at the trachea, it is important because you can tell whether it is shifted to one direction or one side or the other. For example, in patients with pleural effusion, or anything that is pushing or pulling the trachea on one side. So you can tell that the trachea is not symmetrical, it is on one side. You can tell. Then, for example, if someone has pleural effusion on the right side of the lung, of course this side represents the lung, this side I'm shading with green, it represents the right lung because there is air, and as you can see, the color is black. So when there is pleural effusion on this side, it means it will push the trachea towards the other side of the left. So you will know when you have X-ray, you will know. So that is that was a trachea. Now let's go to B. B, let's talk about the bone. Let's talk about the bone. For instance, this is clavicle bone. There are two, left and right. Then we have We have the posterior ribs and then anterior ribs that are running down, as you can see. Posterior ribs and anterior ribs. Maybe we shall get to know more in our next tutorials, but for now, let's just focus on the anatomy of our X-ray. So those are ribs. Then we have the spinal processes that are running down. You can also observe them very well on the X-ray. The spinal processes running down. If one has a problem, you can also see it. If it has a fracture, you can see it. Then we have a bone can have a lesion that is air filled. You can also know some bones a bone may have a lesion that is air free, that has air inside. You can also observe. So let's move directly now to the anatomy. Let's continue with anatomy of X-ray. Let's begin with anatomy of bones. Anatomy of bones. Then we have the clavicle, as you can see very well shaded. Then we have the vertebral body, the posterior rib, anterior rib, as we have been saying. Let's go to anatomy of the heart. As I'm outlining it, let me outline the heart. You'll see it. Yes, as I've outlined the heart, you can see the position of the heart. The apex goes to the other side of the left, pushing on the diaphragm, hemidiaphragm, on the side of the stomach. Then the base, you can see, goes to the right side. So that is our heart. That is its lie, and of course you have to know maybe in our next videos the abnormalities of the heart. Then let's go to the pleura. To the diaphragm. The diaphragm, we have two. We have the right hemidiaphragm and left hemidiaphragm. As you can see, the right hemidiaphragm is slightly above the left hemidiaphragm. Why? It's all about the positions of the heart and the liver. As you can see, the heart is always pushing. Anatomically, the apex of the heart is pushing on the left hemidiaphragm, so it is kinda lower than the right. So we have the pleura, which are the lungs, left and right, as I have outlined in cream color. Those are our lungs. They should be air filled, so they should be black. So in cases where there is a problem with lungs, maybe there are some white patches, white spots, you can know that there is the X-ray, chest X-ray is abnormal. Then we have we also have a small pack of air that is visible on left hemidiaphragm that represents air in the stomach, usually called a gastric air bubble. You shall see what brings that one, what brings that air filled pack in the stomach. We shall know. We have other features in lobes of lungs that are, for example, the horizontal fissure, one of the three fissures that are commonly visible in the normal chest X-ray, and it is always visible in PA view. Let's bring such an example of a plain X-ray of shoulder region, and now we have a plain X-ray of hand. You can see that is bone, those are bones, and whatever. So you can, if you get the basics, the densities, you can get to understand it more maybe we shall keep on explaining more in our next videos. Now, this is an excellent teaching case for someone who has some interest in diagnostic radiology for any reason. Of course, X-rays of the chest. This is for an 11-year-old showing a number of findings. This child is HIV positive and is known to have active tuberculosis. As you can see the robes, you can see the outlines, you can see there are very tiny spots, white